Hi, everyone. Welcome to our discussion of our Special Mentor Project, which is a quality improvement project evaluating the Stanford Mental Health for Asians in Treatment, or SMART Clinic, which was founded to provide unique culturally tailored care for Asian Americans. Our team consists of me, Anna Park, Andrew Vodinh-Ho, and Ivory Rock, with Team Science Fellows Tina Chang and Shinran Key, and mentors Dr. Srinivasan, Dr. Hu, and Dr. Deng. Previous research has indicated that Asian Americans face unique and complex mental health challenges that require culturally congruent care, but there's a lack of ways to measure and identify the effectiveness of culturally congruent care in the literature. The objective of our study is to evaluate the effectiveness of the SMART Clinic and identify key factors that contribute to improving mental health outcomes for Asian Americans. Our methods consisted of surveys and interviews of both the clinicians at the SMART Clinic and referring providers, as well as patient interviews and chart reviews. We formulated a theoretical framework based on our literature review regarding the most important factors to guide the development of our surveys and interviews, combining patient-specific and provider factors as well as health system factors. These three actions will allow us to identify barriers specific to Asian American mental health care, evaluate the effectiveness of the SMART Clinic, and finally, improve culturally appropriate care overall.
Moving on to results, here are the responses from the clinician survey where we asked SMART clinicians about certain barriers to mental health outcomes experienced by general psychiatric patients in comparison to their SMART patients. With our analysis, we observed 5 leading barriers, including preferences for non-medication-based treatment in traditional complementary alternative medicine, or TCM, language non-concordant care, stigma around mental health, gaps in health literacy, access to mental health services. And another interesting finding when we asked SMART clinicians for suggestions on how to improve the SMART Clinic, some common themes included hiring more providers, providing more direct mental health care, and renaming the clinic itself.
In conclusion, because culturally congruent care is novel for Asian Americans, our study results should provide some insight into how SMART Clinic can address these systemic and cultural barriers to help improve mental health outcomes in the future. Our next steps include conducting semi-structured interviews for both patients and providers, as well as recruiting referring providers for a survey and doing patient chart review. Please see our QR code for our abstract and references, and thank you for your time.